guys, Laura Lynn here. Earlier this week, I decided to, sometime within the next 3 years, after the new baby comes along and is done nursing, to undergo a prophylactic or preventive double mastectomy, reconstruction, and radical hysterectomy in order to eliminate my risk for developing ovarian cancer and reduce my risk for breast cancer by 99%. So why am I telling you all of this? And why would I consider taking such radical action to prevent a disease that I don't have and might not ever acquire? Well, as to the first question, I know for myself, whenever facing potentially life-altering decisions, I look at all the information that I can, and then I look for personal stories. I want to see women who have been in a similar situation, understand why they made the decision that they did, and see how that decision played out for them. So that's why I'm putting my personal story out there for you. And if nothing else, hopefully it will motivate other women to go to their yearly screenings, maybe do a risk assessment for gynecologic diseases, and just generally stay on top of this situation, because it is pretty serious. So as to why I made this decision, earlier this week I found out that I am positive for a BRCA1 or BRCA1 gene mutation. Now, BRCA1 and 2 are genes that everybody has that produce a protein that repairs damaged genetic material in your body's cells. So if these genes are mutated, one or more of them, it inhibits your body's ability to fight off tumor formation. And for women, for me, this means that my risk of developing breast cancer goes from 12%, which is the general population risk, to north of 65%. And my risk for developing ovarian cancer jumps as well. It's a pretty significant jump. So I have a couple of options. I can do, on a rotating schedule, MRI and mammograms every 6 months and yearly pap screenings, or I can undergo this prophylactic surgery, which removes 98% of your breast tissue, and they generally recommend removing the ovaries and fallopian tubes as well, since that's where the ovarian cancer develops. I have decided to do a radical hysterectomy and just take everything out, because I also have a history of severe cervical dysplasia, which could come back and turn into cervical cancer. It was one step away from being cancer when I was pregnant with my second baby. So my doctor just recommended to go ahead and take it all out since I'm done having kids. That on top of my family history, which my mom had breast cancer twice. I have 2 aunts that also had breast cancer, 2 sisters of my mom, and the fact that I have very young children has contributed to my making this decision. So I'm young, I have a really good chance, I'm generally pretty healthy, I have a really good chance of recovering well from these surgeries, and for the reconstruction to do well. And I'm doing this for my kids and for my husband, because I don't want to run the risk of being diagnosed with this disease later in life when they're older and in school, and you know, we'll have memories of me being sick and going through all of that then. So I'm just going to do the surgery now and recover from it while they're still young, and probably not have very many memories of, you know, of the whole situation. I think the whole process will take about, I don't know, 6 or 8 months, something like that. So if this is relevant to you or somebody you know and you want to follow me along this journey, I'd be happy for the company.